Hello everyone, welcome back to health discussions on chronic diseases. Today I'll be talking on another chronic disease, heart disease. Heart disease is any disease that affects the heart. So many things could lead to the heart being diseased. Number one, other chronic diseases can predispose one to having heart diseases. Chronic diseases such as diabetes, hypertension can also predispose one to having heart disease later in life. Number two, medication. Misuse of medication can predispose you to having heart disease later in life. Are you taking heart drugs? Are you taking drugs that you ought not to take? Are you taking drugs in quantities that you ought not to take, especially in excess? This can predispose you to having heart disease later in life. Nutrition. What are the things you eat? What are the things you take into your body? Are you taking things that are highly toxic? Foods that contain toxicants? This can predispose you to having heart disease later in life. There are several types of heart diseases, but I'm going to mention and talk about a few common ones here. Number one, coronary artery disease. Coronary artery disease affects the arteries of the heart, making it difficult for the heart to pump blood to different parts of the body. The second one is heart valve diseases. Heart valve diseases are diseases that affect the valves of the heart. There are so many. I'm going to mention and talk about some common ones. Number one, endocarditis. Number two, we have rheumatic heart disease. Number three, we have pericardial heart disease. Number four, we have cardiomyopathy, which is disease of the heart muscles. Then we have number six, congenital heart disease, which affects the newborn or a baby in the womb. Then we have septal abnormalities, which has to do with perforations in the heart, that's holes in the heart walls. Then when once all this come into play, especially if it has been there for a long time, certainly the pressure on the heart becomes too much, and at the long run would lead to heart failure. And heart failure sets in when the heart is unable to carry out its function. So in our next episode, I'm going to talk about more chronic disease prevalence in our populations. Thank you.